Okay, so now we're gonna do the NP. Now when you're doing the NP, you are always going to place topical on the same side that you sit, and you're gonna inject on the same side. So it doesn't matter if you're doing the right or the left, you will always inject on the same side you sit because it gets the whole anterior palate numb regardless of what side you're doing. So you're gonna place the topical, this is my right-handed operator, so she's gonna place the topical on the same side she's sitting because that's where she's going to inject. And you're gonna, again, hold the topical for 1 full minute so that you make this injection more comfortable for your patient. Okay, so we're saying that we've now held that topical for a minute. We're going to grab our syringe. We're gonna pick up our syringe. Okay, we want big window down, and then we want to grab it palm up, big window up. We're gonna take our cap off. And we're going to grab our dry topical, or dry cotton tip applicator. Now we're going to put pressure on the opposite side of the incisive papilla. You don't want to actually put pressure on top of the incisive papilla because it's tender, but you want to push to the side. Again, she's fulcruming on a tooth, so we want to make sure that we're fulcruming on a tooth and we're getting good pressure so that we actually see that papilla start to blanch. That's the key, is we want it 30 seconds of really good blanching. Now when she inserts her needle, we want to make sure that the bevel is toward the bone. This is the one injection that you want to make sure the bevel is toward the bone so that the anesthetic drips into the incisive foramen. Otherwise, it's going to spray out all over your patient's mouth and get you and not be an effective injection. So when we're looking for the bevel, you want to push just a little drop of anesthetic so that you can see the tip, so that you see that the bevel is facing towards the bone. If it's not, you can just take your fingers and kind of turn it right here without touching the needle to contaminate, okay? So we can see that the bevel's toward the bone. We can see that we've got blanching, and she's going to insert right to the side of the papilla, that incisive papilla, and not in the papilla, but right next to it. Good. Now this one's going to be a little uncomfortable for your patient, so you want to warn your patient that there's going to be a lot of pressure.
Minimum penetration site.
I see, proceed. And we're going to slide about 2 to 4 millimeters underneath that incisive papilla.
Maximum depth and angulation.
I see, proceed.
Aspirating. Negative.
I see, proceed.
Depositing.
And when you're depositing, you're going to feel a lot of pressure. It's going to be very difficult to get the anesthetic in at this point because there is a lot of pressure. It's a very tight space. But just be patient, and you get about 0.3 milliliters in there and you should be good to go. All right, you can go ahead and withdraw.